You're at the end zone of your pregnancy. You're in your third trimester. Today, I want to share 5 mistakes that I see people making during their third trimester and what you can do to remedy them, because these can all be fixed. Of course, when you're learning about mistakes, make sure that you're learning from an actual expert. And I am one. Hello, I'm Hilary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, plus 3 of my own. And now I'm an online birth educator, which means I watch what people are doing with their pregnancy, millions of them all the time. And I've seen 5 things that people really forget to do or aren't doing that could help you have a better pregnancy. And honestly, even a safer one. So stay tuned. The first one is sticking with a provider that you do not trust. Now, this is tricky. A lot of you may only have one provider in your area or just a couple, or insurance may be really limiting as to who you can see. But if you don't trust your provider and you're before 30-ish weeks, you still have time to switch if that's an option in your area. It seems like it's like a really big deal to switch providers, but I'm here to tell you that it actually isn't that big of a deal, and it can be done pretty easily. What I would do is just call around other providers, see if they're accepting new patients, they're going to ask a little bit about your history, and then see if you can do a visit with them. Now, the grass isn't always greener. You may find that the other provider you dislike even more than your current one, but I think it's worth the time and the effort to see if you could find another provider that fits you well. I cannot tell you how often I had patients who came in wanting XYZ on their birth plan, and me looking at their provider and thinking, how on earth did you two get matched? Because it was not a match made in heaven. So I always want to make sure that you guys are realizing there are other options that you could switch to during your pregnancy. Note, if you're after 30 weeks, I have seen it be difficult to switch. A lot of providers don't want to take on new patients that are further on in their pregnancy unless there's a reason like they're moving or something like that. So this tip is for people who are a little bit earlier in their third trimester. As a note, if you're like, when the heck does the third trimester start? It's usually your last 3 months of pregnancy, starting around 27 weeks. Okay, the next mistake I see so many people doing wrong is not doing kick counts or doing them incorrectly. And the unfortunate thing is that a lot of these people are doing the kick counts the way their provider tells them to do it, and it is incorrect. So, kick counts start around 27 weeks. And you're looking to see how long it takes your baby to give you 10 kicks. Then you're going to note that time. So let's say one day it takes you 10 minutes, the next day it takes you 20 minutes, the next day it takes you 15. You're thinking, okay, we're in the 10 to 20 minute range of how long it takes my baby to give me 10 kicks. Now, a lot of providers out there recommend that you make sure the baby gives you 10 kicks in 2 hours. But I got to tell you, for Hilary, with my babies, if it had taken them 2 hours to give me 10 kicks, that was a sign that something was really wrong. My babies always gave me 10 kicks within 30 minutes. So that's why we only compare your baby with your baby, and that's why we do the how long it takes to get 10 kicks. Now, a lot of you are going to say it increases my anxiety, and what I'm going to say to you is to give it a try for a week and also sit there and dream about you and your baby. It is a great time to bond with your baby, in addition to making sure that they're doing well in the womb. Fun fact about kick counts don't always show something's wrong with baby. They can actually show that something is wrong with you. I cannot tell you how many people ended up finding something like preeclampsia or cholestasis because their kick counts were off. They went into the hospital, and then the doctor there found out that something was wrong with them. So I'm a huge fan of kick counts. If you don't know how to do them, I'm going to put my cheat sheet down below. You guys can grab it and make sure that you're doing your kick counts. Pro tip, I made sure to do my kick counts every day at about the same time of day, which was after I ate dinner. Not only did I get out of cleaning up dinner, but it was also a time that my baby tended to move a lot, so it was easier to get the kick counts in. Of course, there were days that I forgot, and I either did it later in the day or I just did it the next morning. This isn't a perfect science, but you're just trying to do it as well as you can. If you are not doing kick counts, I'm going to challenge you to start today, and let me tell you the reason. When this type of kick count is done, it lowers the stillbirth rate by 33%. There was a state in which they initiated doing kick counts where you see how long it takes your baby to get you 10 movements. And when they did that, kick counts lowered by 33%. So this isn't something that I'm just like blowing smoke in your face. Kick counts are important. Please make sure that you're starting them. And again, we start usually around 27 weeks. Some providers, if you're high risk, will say 25 weeks. And I have a whole podcast episode on when to start kick counts and all the questions that you have, and I'll put that link down below as well. Okay, the third mistake that I see people doing most often is not understanding third trimester testing. Now, third trimester testing is not super complicated. There honestly are not all that many tests that we generally order for pregnancy. They include preeclampsia labs, an NST, a BPP, and a few things like that. However, so many people just let their doctor figure it out and have no idea why they're being tested or what the results could mean that they end up having the test. They have results that maybe are not top notch. And then their provider says, well, you could get induced. And they feel like they have to get induced because they never understood anything at all. And then they end up getting induced and things just don't go according to their plan. Versus not everything is black and white in pregnancy. If you understand why we're doing the testing, you could say, hey, could we wait a little bit? Hey, do we really need to do this now? You could really probe with your provider about what's important to you, your birth priority, which may not be having a 48-hour labor, and seeing if that could be more important than baby needing to come out now. Now, I'm not saying that sometimes these third trimester tests really show that you need to get your baby out, but sometimes they show a lot of wiggle room, and when you understand them, you can really use the results to your benefit. Now, most birth classes start during labor, and I think that's doing a disservice. The online prenatal class for couples actually starts in your third trimester and goes through third trimester testing. So come join me in there so that we can start at the beginning when a lot of labor sort of goes off the rails. And then of course we progress through labor, birth, postpartum. You want to get the whole picture. So take a birth class that does just that. Okay, the fourth mistake that I see people making really frequently is not getting their birth class in early enough. So many people are like, great, I've got 40 weeks to finish this birth class. Like finals are in December. But you really want to aim to finish that birth class by around 34 to 35 weeks, which means that hopefully you're starting at around 30 weeks. Now, there are hospital birth classes that take up to 6 weeks, and there are birth classes online that I see showing 30 hours of information for you. I do not believe that a good birth class needs to take that long. I think a good birth class can be done in 3 to 4 hours and you can be on your way. This is why I really like online ones. Sometimes hospital ones are really hard to schedule. They're really hard to mesh with your partner. So make sure that you're getting a birth class in early and getting it actually done. Pro tip, I think that's one of the downfalls of online classes is a lot of people purchase them, but maybe you don't finish the whole thing. So when you take a class, make sure that you're signing up for the emails that will encourage you to get in there and actually get it done. Side note, the online prenatal class for couples 100% does. I'll email you every 2 to 3 days to make sure that you're getting the class done. Okay, the final mistake that I see people making frequently in their third trimester is not preparing for postpartum. Just like people getting married often prepare only for the wedding, they're not thinking about their life with this person. We want to make sure that you're also preparing for postpartum. In fact, when I took a birth class in 2000 with my first baby, they sort of acted like it would just be unicorns and rainbows after I had that baby. Nothing would go wrong. It would be so darn easy. Whereas I found out that my bum really hurt. Breastfeeding wasn't as easy as I thought it was going to be. And I had a lot of feelings that I just didn't know what to do with because I was not prepared. I absolutely do not want that for you. Come join me in the online prenatal class for couples where we have 2 full chapters on managing life postpartum. One is about the hospital, making sure that you get as much as you can out of those postpartum nurses in the hospital because they are a treasure trove of information that is often not used. And then we have another chapter about when you go home and those first months after you have your baby and what to expect then. It is one of the things that I hear in the reviews that people absolutely love because they like the realistic picture that I paint about what life is going to be like postpartum, when to get help, and a reminder that things are just going to get a little better every day. Okay, I hope you guys like this video. One of the other mistakes is people not preparing their cervix in advance. So I'm going to pop that video over here, and I think you guys are really going to find that one helpful. It's something that a lot of people don't talk about, so let's get that cervix ready.